As at now, 316 suspected cases, 107 of those cases have been confirmed as COVID-19.
Me aware say what to say the almighty COVID-19 pandemic as our system no be am see an area of na say another pandemic in 2025. It is fast trending. How is it trending arena and what is pa am Ghana no e be hu ni say Ghana as a COVID as I started 2025 you know as a COVID as a unity as a trending and area you know under the health minister Kwabena Kando press briefing on COVID-19 and Mpox virus no na active cases are a woman no Kwabena abeka ni na area check Ghana for now in this video remember how the press briefing on my no mafi matome bo ase I breaking it down am also what you say I Penyah block media mess was any day over like a video no that my subscribe button so back the notification and latest updates now better why you dey mama e will comment section so baso you must you know for any be action Intimator friend and COVID-19 as I am an homeless in 2025 in a air trend here. Oko India, they say Omudia, run on Omonam over 6,000 plus active cases. Active, when you're suspected, active cases, and over 6,000 plus. Oh, India. Ama Africa can do in a serious in the COVID-19 as a man homes are air trendy. Now, Ghana no, a woman say, as a COVID, a unity, our Ghana. Maybe COVID was somewhere in February. And I'm just a COVID SR or Honomo. It's me met him say no COVID-19 tax and this is going to mean Pemuda. And that is the reason Omuri do budget no. Omen to many COVID-19 tax and free. Oh, the question say IMF. They don't mean say IMF because I was say COVID-19 is there and it is gradually going up in Ghana. It is gradually going up in Ghana. Now the man never did answer few days ago. Legon University of Ghana, only a week whole program be that week whole program say any part by Emma na a dom etapa after I don't know you know. And I said, students need be start to report some symptoms be near the others say me yare say me why shame me boy 1 year the thing. As move here, omo ewo sa symptoms you know say I can't come with test. Go here tell you say na I confirm COVID-19. It enuachi enene Legon authorities school penny for no any president about to much now no there any activity where they deal with gathering no omo place ban on it omo attraction what I say omo air card because now no COVID-19 no a unity the dia bra e be for you na yase
they are lying. I think they want to cancel the enjoyment on campus. Yeah, that's what.
To cancel?
Yeah, they don't find a way to cancel the enjoyment on campus. Yes, that's why.
Which enjoyment?
See the whole weeks, departmental weeks and things. Yeah.
That's why you don't believe them.
Sure.
So as a student, you are not concerned. You don't fear that COVID is indeed.
Oh no.
If you have any honorable cabinet account, our health minister, and no move like say, and then obey brief Ghana for on COVID-19 number of cases are active. Number of suspected cases are any death to any other and no NS Okopi Ghana Parliament and I Okopi brief. And in case I COVID-19 Ukraine. The man, you know, a trend there is Abi will be our Ghana, a programmer, something like a programmer, Legon a course for Hormono, and no the man, COVID, you know, also our Ghana. Now, across the country, we record those suspected cases of 316. Out of 316, 107 active cases that is case that are being confirmed as a COVID, or we know COVID-19, over 107.
Our surveillance system remains active and ready to detect and respond effectively. The Speaker, as at now, 316 suspected cases, 107 of those cases have been confirmed as COVID-19. Fortunately, Mr. Speaker, there are no hospitalizations and, more importantly, no deaths. Mr. Speaker, so far, the outbreak is limited to the university community. It has not spread widely to other parts of Accra or the rest of the country. As I mentioned earlier, all confirmed cases are recovering well. Mr. Speaker, after sending a team to investigate, we found a few key issues that fueled the spread. The biggest factor was the recent hall celebration held in the university. These events brought large crowds together with little use of face masks or distancing. Following our investigations, even after the university community became aware, we also noticed a drop in adherence to basic COVID-19 safety protocols and some challenges with contact tracing. Mr. Speaker, once the first signals came in, we moved quickly. Here's what we did. Sent a national team to work with university and municipal health authorities, held meetings with the Director General of Ghana Health Service, head of Noguchi, and the School of Public Health. We issued alerts to all health facilities nationwide. The university suspended all hall week activities, launched a campus-wide education campaign using posters, campus radio, and student leaders. Mr. Speaker, what next? We are not stopping there. Additional steps underway include supporting Legon Hospital and Student Clinic with more resources, preparing the Ghana Infectious Disease Center to handle severe cases if any occur, holding face-to-face sessions with student bodies and faculty, providing more PPEs and training for frontline health workers, enhancing our data tracking in all health facilities, including mapping where cases are coming from, and continuing to test and monitor daily. Mr. Speaker, I want to assure Ghanaians that this is not a new virus, and we are not back to 2020. This Omicron variant has been with us before. It spread fast, yes, but it is mostly mild, and we know how to manage it. We have beaten back bigger waves before, and we can do it again with calm, cooperation, and good public health practices. Mr. Speaker, I wish to clarify that COVID-19 vaccination is no longer part of the country's routine immunization program. Indeed, this is the case in most countries. That said, vaccinations remain one of the important tools that can be used to control the spread of COVID-19 infections, and more importantly, prevent severe disease and death. As a result, and in preparation for potential surge, we have initiated the necessary processes to secure vaccination in country. This is in line with our policy to protect the health of vulnerable populations, particularly people with underlying medical conditions and the aged, who are more likely to develop more severe disease. Additionally, I wish to assure the public that treatment is available for COVID-19. Paxlovid, an antiviral that is taken twice a day for 5 days only, is recommended for patients with mild to moderate COVID-19 who have comorbidities such as diabetes and hypertension. It has proven effective and has minimal side effects. Generally, Mr. Speaker, treatment for those who get infected is based on symptoms. Most people recover at home. For more serious cases, our hospitals are prepared and stocked to provide oxygen therapy and all the necessary care. Mr. Speaker, let me also mention that we are seeing a rise in seasonal flu cases, as we do have during the rainy season. These flu symptoms, fever, cough, sore throat, can look like COVID-19. So we urge anyone feeling unwell to go to the nearest health facility. Also, though the number of cholera cases are down, we are still reporting cases, especially during this rainy season. Some of the risk specific to COVID-19 some of the risk factors for cholera lie beyond the health sector. We urge all to wash their hands with soap and running water, eat food that is hot, and drink potable drinking water. Mr. Speaker, you will agree with me that the tackling of cholera goes beyond the health sector. Keeping our environment clean is also a very important way of preventing cholera in our country. Finally, Mr. Speaker, as of 29 June, we had confirmed 133 cases of Mpox, mostly in the Western, Greater Accra, and Western North regions. It is essential to note that there are currently no admissions, and we have had no deaths associated with Mpox outbreak to date. Additionally, except for the cases confirmed in the past week, all affected individuals have fully recovered. Mr. Speaker, Mpox spread through close contact, and we all need to stay safe. Avoid close contact with anyone with symptoms suggestive of Mpox, which include fever, rash, headache, and swollen lymph nodes. And protect ourselves by washing our hands regularly with soap and water. Specific to COVID-19, here is what each of us can do to help stop the spread. I must add that most of these universal precautions apply to both flu and COVID-19. Wash hands regularly with soap and water. Wear a mask in crowded or poorly ventilated places. Stay home when feeling unwell. Avoid gathering if you are sick, and go to the nearest clinic as soon as you notice symptoms. The Ministry of Health has made sure that our responses is well-resourced. PPEs, test kits, and treatment supplies are all in place. Health workers are being supported, and emergency centers like the Ghana Infectious Disease Center are all on standby. In conclusion, Mr. Speaker, this is a localized outbreak, and we are on top of it. There is no need for panic. However, we must remain vigilant and responsible. The Ministry of Health and its agencies remain committed to protecting the health of all Ghanaians, students, workers, families, and the vulnerable alike. Let us each do our part to keep our communities safe. Mr. Speaker, COVID is not over, but neither is our resolve. May the good Lord bless our homeland, Ghana. I thank you for the opportunity.
Ghana, ya hu se enwosie ese bibia bebia no ye be keke ye be butu no virus bia ma se be born gather way be keke outside the country. Now, August Ekasana, and another update be and there's a go viral on the internet according to post. There are 6 children and 86 hospital staffs tested positive for COVID-19 in Hohoi, that is Volta region. A whole mono and Kuramakumaku 6 and 86 hospital staff. There's a woman here hospital and 86 are tested positive for this COVID-19 pandemic. Answer started to go for 2025. Now they all have on see. According to the health minister and there across the country, there were 107 active cases as it stands now. Ubia Emwe and Ubia situation and yet critical. What I say, and yet critical. So this is what the health minister, Honorable Minta Kwabena Kando, has to say so far as COVID-19 cases. And yet concern all man on see, but home by it was and go through and said they went home and said, so Munina Amishem Ewa Legon Honma, you because of you are COVID-19 Ghana. And it just said, any penny be will be a almost low key. But yes, if you are a major critical situation, to maybe our fans say, oh, Menaka, Menaku, send you more fun. It will not your own see. Social distancing, what I say, or on Sano, Veronica Bucket, okay, we fear. Veronica Bucket. Anna, Hanson and Tizer, Hanson and Trazer, what I say, two chatter voice, Hanson and Trazer. Now, with the different ones, that's your mamma, commercials, now you can have